Well, hello. Welcome to Camp Talk 2024. This is Bill Kennedy. I am the chair of the Global Interdependence Center, and I'm here with my friend Emily Taylor, who's come all the way from Los Angeles to fish in Outback, Maine. Emily is the newly minted CEO of Solve ME, and it's great to see you again.
Oh, it's great to be here.
Yeah, it's been a couple of years.
It has.
Tell us a little bit about the work you're doing at Solve ME and help the audience understand the great work that takes place there.
Thank you. Well, I can't live up to that introduction, but I'll do my best. I am so pleased to be the new president of Solve ME, and we are a biomedical research nonprofit. We are focused on finding answers and hopefully a cure for chronic fatigue syndrome and other post-infection diseases, particularly long COVID, which is a really prominent one right now. But there's also MCAS, which is mast cell activation syndrome. There's also POTS, postural orthostatic tachycardia syndrome, and a number of others that all qualify as a family of diseases. And what they have in common is they're triggered by viruses. And about 10 to 20% of people will get these long-term tails behind a viral infection like COVID. And we're trying to find the answers for that and get people back to wellness and back into the workforce and getting their lives back.
Terrific. So the organization itself, nonprofit,
correct,
based in LA. Tell us a little bit about your team and the work that they're doing.
We are small but mighty. We punch above our weight class. We have 3 programming areas that we focus on in a team in each of these 3 departments. Our biggest and most robust, and about 80% of our programming dollars goes to our research program, which is funding grants, conducting research, our Solve Together data platform that enables clinical trials and research to be conducted cheaper and at a offsite location, so you can lower the cost of clinical trials by using our platform. And what's really great about our research platforms is they're portable on your phone, so that if you're somebody who is affected by these diseases in a very severe way, by severe I mean unable to leave bed, unable to leave your home, how do we study you if we can't get you into the doctor's office or into the clinic? So our platform is really meant to close that gap and close that divide to make sure we're not only studying people who are mild or moderately affected, but we're studying the most sickest and most vulnerable among us as well.
So we had a conversation at dinner last night about how long COVID is still long. It's still with us.
Very much so.
And very surprised to hear how many people, 1 degree of separation, know someone suffering from long COVID. It was my understanding that there are a number of long COVID clinics that have been popping up around the country,
yes,
associated with hospital systems and the like. Can you just talk about that a little bit?
It's a bit of the Wild West right now, because there's no governing body, there's no association of doctors that is saying we are responsible for long COVID. So it's sort of a long COVID clinic can be anything from a comprehensive clinical care center that gives you 360 wraparound care to just a referral service that's taking your insurance money and sending you out and giving you nothing. So I would say double check which long COVID clinic you're looking at, because there are some that are not good actors, and then there are some that are amazing. So it can be really different. And also these long COVID clinics reflect the wide spectrum of diseases that can fall under long COVID. Long COVID is ultimately an umbrella term. It means anybody who had a long sickness following COVID. And that can be a number of different illnesses. The most prominent among them is chronic fatigue syndrome, or known as myalgic encephalomyelitis, ME. That's the one that we focus on. And so I would encourage people who think that might be their disease, look for an ME specialist instead of a long COVID specialist, because these diseases were around before COVID. They're still here. And somebody who's looking at it just from the COVID lens might be missing some of the long-term impacts.
Understood. And if somebody wanted to find out more about Solve ME and the organization, what's the website? Where should they go?
Oh, absolutely. We're at www.solveme.com or .org. You can find us on social media at Please Solve CFS, and also on Facebook under Solve ME CFS Initiative.
Terrific. And Emily, just to wrap up, how was the fishing this morning?
Amazing! I actually didn't get any in the boat because I was reeling so aggressively that they jumped off the line before I could get them in the boat. But we had at least, oh my goodness, like 8 to 10 fish that we got in. My partner, Alejandra, was just nailing it today.
Good. Productive morning.
Amazing. And thank you so much for having me. This was just, this Camp Talk is such an exceptional experience.
Yeah, I agree. But Emily Taylor from Solve ME, thank you for joining us.
Thank you.